Hello, this is a model of the integument, and we're going to use it to learn about the anatomy of the integument. There are three different types of skin shown on the model, and so in this area here we have a thick skin, and in the middle section here we have an example of the skin from the armpit. And in the third section in here, we have example of skin from the scalp. All three uh, examples they show the basic structure of the skin. So in the upper layer here, that is the epidermis layer, and the lower layer here is the dermis layer. And then the bottom layer, where we have all of this adipose tissue, that is the hypodermis, or also known as the subcutaneous layer. In the epidermis layer, we can see also the four layers of the epidermis in the armpit and in the scalp, and we can also see the five layers of the epidermis in the thick skin. The bottom layer of the epidermis is the stratum basal. It's also known as the stratum germinativum. It's a single layer of cells. Um, it's important because it's actively dividing, and it forms all the cells that we see in the epidermis layer. The second layer on top of that is the stratum spinosum, and then the layer on top of that, which has lots of pigments in it, is known as the stratum granulosum. And in the thick skin, we have a layer known as stratum lucidum. That is only found in the thick skin. And then on the top in here, we have all the layers of the stratum corneum, and they are all dead cells uh, because they mostly contain the protein keratin, and they lose all of their cytoplasmic contents. And those are the cells basically that we lose. Now, the epidermis layer is also an example on what we call stratified squamous epithelium tissue. The layer below the epidermis is the dermis layer, and that's an example of dense, irregular connective tissue. All the red and blue that we see in the dermis layer represents blood vessels, so those are the arteries and the veins that supply blood to the skin. We also notice in the uh, dermis layer glands, and there are two kind of glands. In the model, they show the glands that are associated with the hair follicles, and those are known as the sebaceous glands. Those are the glands that produce the oil that will lubricate the skin, and also some of the fatty acids in the oil is actually kill bacteria, so they have what we call uh, bactericidal properties. The other type of glands are sweaty glands, and these are also divided into two types, and they show them in the model in two different colors. The white glands that they show on the model, those represents what is known as eccrine sweaty glands. Those are the ones we are very familiar with that produce the sweat that we know of. And so they show the granular portion, and then they show the duct that will carry the secretions, the sweat, and you notice it opens at the surface of the skin. The other kind of sweaty gland is shown in the middle section here, and it's shown in a different color. Those are only found in the armpit and in the pubic area, and those are known as the apocrine glands. They produce milky type of secretions, and the duct portion normally opens in the hair follicle, but it's not shown on the model that way. The other components shown on the model that is important to the function of the skin are receptors. And there are three kinds of receptors associated with the nervous system of the skin. One kind of receptors is known as the free nerve endings, which are basically, if you follow the nerves, and they will terminate into areas in there which are known as the free nerve endings. Those are sensitive to touch and also pain. The other kind of receptors are shown in this part in here, and they are shown closer to the epidermis layer. Those are known as the Mesner's corpuscles, and these are known as touch receptors. And the third type that's shown on the model is shown in the lower portion here, and they look on the model like onions. Those are, you notice, deeper in the skin, and those are called Pacinian corpuscle. And because they're located deeper in the skin, they are sensitive to pressure. The other components shown on the model are muscle structures associated with hair follicles. And so if we look at this part in here, that's a muscle attached to the hair follicle, and on the other end attached to the epidermis layer. This is known as the errector pili muscle, and it has nerve connection, and the nerve will stimulate the muscle when you are stressed, and it will cause movement of the hair. So that's the basic anatomy of the integument shown on the three different sections of the human body.